New Jersey is revising its pandemic flu strategy to deal with a potentially more lethal strain of swine flu this fall. The feds say they'll give New Jersey $10 million for preparedness, which includes swine flu vaccine. The state is in the midst of an ongoing planning summit that stretches into September. NJN News health and medical correspondent Sarah Lee Kessler was at yesterday's opening session.
We know that time is of the essence as New Jersey continues to plan for H1 influenza and its possible reemergence this fall.
The summit's focus is on coordinating elements that are critical to a successful pandemic response. They include surveillance, vaccination planning, and communication.
Be first, be right, be credible, express sympathy, promote action, and show respect.
Worldwide, there have been 429 swine flu deaths, including 211 in the U.S. 10 of those deaths have been here in New Jersey. The CDC estimates that more than 1 million Americans have contracted swine flu.
The populations that appear to be most affected by this new H1N1 strain are school-age children, non-elderly adults with underlying illnesses such as diabetes, asthma, and obesity, and pregnant women.
These are the groups that would be vaccinated first in a campaign that would stretch over several months. 5 vaccine manufacturers are expected to produce at least 40 million doses by mid-October. Still, while New Jersey plans, the federal government has made no final decision on whether to vaccinate for swine flu. That will depend on the outcome of clinical trials set to begin next month on vaccine to test safety, efficacy, and dosage.
If the decision is made to vaccinate, the plan is to have enough vaccine available for anyone who wants it or needs it over a period of time.
We have a hard enough time getting to everybody who could use the seasonal flu vaccine to accept it. Now we're going to be asking people to accept an initial H1N1 shot, a second H1N1 shot, as well as a seasonal flu vaccine. We have a lot of information to get out to the public.
How to administer the shots would also pose challenges. There's concern that we don't have enough vaccinators.
I think we need to explore alternate sources of vaccinators, whether it be allowing other individuals in a community to vaccinate other than our traditional nurses and physicians.
Pharmacists, maybe?
Exactly. Pharmacists, EMTs, veterinarians. We've got a variety of other health personnel in our communities who know how to administer injections.
Meanwhile, there are measures we all can take to protect ourselves and others.
If you have a cold, if you have a runny nose, cover your cough, hand wash, and if you're sick, stay home, don't go to school, don't share it with somebody else.
Ultimately, pandemic flu response will involve everyone's cooperation. Sarah Lee Kessler, NJN News, New Brunswick.